short interview survey of 130 women this past summer. They were mostly women. It wasn't just women, but there were mostly women, mostly over the age of 35 in Langley Park. The majority of them were born in another country and have been here for over 10 years. And we were asking because we thought about this idea of maybe it is because people are not comfortable drinking water in their home countries. We're talking about Latinos, recent immigrants, maybe the water sources in their country of origin are not safe. And they're bringing those behaviors and those perceptions with them. So we did a quick and dirty, if you want, survey to investigate some of this. And we found out that the evidence doesn't quite suggest that. That 58%, at least in the sample, reported that they drank tap water. That reported that they drank bottled water in their home country. And the reasons that were reported were mostly convenience, followed very closely by taste, and safety, and finally cost. So we want to discuss be able to engage in the panel. So they're drinking tap water mostly in their home countries, but only, same survey, mostly bottled water here in the United States. So there's a shift in behavior. This is what this suggests, at least, that there's a shift of behavior within that migration process. So Water Up came from this formative work. The logo was developed and the messages were developed from all the formative work that I presented earlier, along with focus group discussions we had with youth, with the objective of improving access to drinking water in Langley Park, eventually changing attitudes and perceptions about drinking water, and then actually changing also the behaviors, and eventually decreasing the sugary drink consumption. The campaign was developed to highlight youth that are thirsty, or when youth are playing sports or being active, makes them drink more. Health and beauty benefits of drinking water, and also messages that are endorsed by Latino celebrities. It was something that came up during the focus group discussions, where we have a lot of Latino celebrities endorsing Pepsi and Coca-Cola and sugary drink products with no one endorsing water. And so we attempted to do some of that in our promotions. You can see here 2 local celebrities. These are the beauty queens of the Carnaval de San Miguel. As part of the project, we also have a social media campaign, and you can see our Facebook, Instagram, Twitter, that you can please follow us and help promote the message as well, and learn bits and pieces of research and how to make water taste better, what to do if you're concerned about drinking water that's unsafe, things like that. The website is available in Spanish. We also have the exact same website in English, and you can find also resources that we have used for our research, and also national and local partners are featured here as well. And we have outdoor advertising that recently started using the Water Up posters. These are both mostly in Spanish, but in Spanish and English. And they're right now in 7 bus shelter locations for the next 12 months in Langley Park area. And ultimately, our latest project, and I think most innovative at this point, is to increase the access to drinking water. We are installing water fountains in schools, select schools in Langley Park, but we also have started installing what we call Water Up stations in select venues. These are restaurants and different businesses that are locally owned in Langley Park. The idea is to offer chilled drinking water to customers, but also to raise awareness about the benefits of drinking water, how to make your water taste better, what to do if you're concerned about the safety of your water. We are promoting drinking both bottled and tap water, and the discussion today is really concerning more tap water, because we know already that people in our community are drinking bottled water. But could there be an advantage to having them increase their tap water consumption, just plain tap water consumption, and see then therefore a further decrease in sugary drinks because they don't have to pay extra for that bottled water? So without further ado, I would like to invite Yvonne Rivera, who's from the Rivera Group. She is our community liaison in this project, and she has been in charge and leading really the effort, and her team, in engaging the business owners with the Water Up stations. We also have other partners here in the audience that have been helping us with that. So John and Coleman, feel free also to interject to talk about your own efforts.
So we started developing these relationships with business owners in Langley Park, and to talk about and try to motivate them to collaborate and to place a water station. So what happens is the requirements will be, we met with them, we had I don't know how many meetings. Here is Lydia and Lucia. And Lucia helped me out to visit I don't know how many restaurants, but many, many restaurants. So what we really find out that the key here is to have people like Rosibel Arbaiza here, who's a leader in the business community, to really collaborate and get support. So in any way, what will be is the cooler with water on display and available at anyone offering ice water, posters and information about the health benefits. So we went and talked to business owners, and the first one that helped us out, what happened here? Was inside Union Mall. There is Ricos Paletas, by the way, they are so good. Natural organic fruits, paletas, ice popsicles. You know, and here we are. We opened our first water station at Union Mall. Here is Rigo and I. Here I am cutting lemons at the water station, placing our first water station. This is Pollo Rico restaurant in Langley Park. Here is the manager. There is Lucia talking to the customers and about the health benefits of drinking water. Can
you tell us a little bit about what the station involves, what it is that you tell them, and also these weren't the very first attempts weren't actually very successful. It took a couple of attempts to find good partners.
Yes, absolutely, absolutely. And then we visit many restaurants, many business owners. But luckily enough, we were able to place 5 water stations. Here's Valdemar Travel. Our Latino community still uses a travel agency. No purchasing internet, and by the way, they're very cheap prices in Langley Park. And so they have a water station there. And and here we have Golden Caesar Salon in Langley Park. And here we have the owner, Rosibel Arbaiza. There is the manager, her name is Maria. And the customers, and here we are in Puente de Oro restaurants. They have wonderful fried fish, fresh. And here it is our business, Cocos Salvadoreño Empresarial, and she is Rosibel Arbaiza here with us, who have been a leader and very supportive business leader in our Salvadorian community. So once we placed 5 water stations that took many visits in different restaurants, I don't know how many, maybe 20, 25, visiting talking about the benefits, about water consumption, and how will this impact our Latino community and health. Anyway, once they were placed, we developed a checklist. And so we had Lucia and Lydia stopping by twice a week, at least twice a week, to do an observational check-in list. And so basically, we wanted to find out from them about, evaluate about the outcome. Are people drinking the water? Are people curious about it? What are their reactions? We had very positive reactions. And maybe you can add up, Lucia and Lydia, you can add up about the reactions from the water stations. A little bit English or Spanish is fine. Spanish. Oh, Spanish, okay, go ahead.
Oh, mi nombre es Lidia.
Wait, my name is Lydia.
Let's get your microphone.
Mi nombre es Lidia.
My name is Lydia.
Estamos trabajando con la comunidad en Langley Park.
We are working with the Latino community in Langley Park.
La comunidad latina. estamos haciendo conciencia a todas las personas
We are raising awareness
sobre el agua.
about water consumption.
Tenemos que tomar agua a diario,
I
¿verdad?
tell them we have to take
para
water every
evitar,
day
para evitar el alto índice de diabetes.
to prevent
¿Por
a
qué?
high incidence of diabetes.
Porque
Why?
los jugos tienen mucha
Because
azúcar,
juices have too much sugar.
el agua es más cómoda,
Water, it's
no
gentle,
consume mucho dinero.
it's free, it's not expensive.
Y es por eso que nosotros como comunidad latina
And
estamos
that's
haciendo
why, as a
conciencia
Latino community, we're
a
raising
todas las
awareness
personas, se incentiva,
about everyone,
se les
to
explica
motivate,
cuál es
to
el
talk to them
beneficio
about
de
the
tomar
benefits,
suficiente
to
agua
drink
a diario.
plenty of water
Evitamos las
every day.
enfermedades,
We
especialmente la
avoid
diabetes,
diseases, especially diabetes,
y evitamos otras enfermedades
and we
más.
avoid other chronic illness.
Y hasta este momento
So up to
yo
now,
trabajo, paso a supervisar
I
las
stop
estaciones
by
del
and
agua
supervise the water
y las
stations.
personas toman agua. Están
Everybody's
tomando
drinking water.
constantemente.
Constantly.
Todo el mundo.
Everybody.
Y los dueños de los restaurantes,
And
e
the owners,
incluso,
the business
se
owners,
les está haciendo conciencia.
we are talking to
¿verdad?
them to raise
Porque
awareness.
como ellos venden los jugos y
Because
las
they sell
sodas,
the juices, they sell the sodas,
Coca-Cola, cola champán,
Cola,
etc.
champagne, everything.
Entonces ellos están colaborando con
So
nosotros,
they are collaborating with
haciendo
us,
conciencia
raising
para que
awareness.
las personas tomen agua.
So
¿Verdad?
that
E
we have
incluso el Puente de Oro, ellos han puesto
restaurant,
copitas
Puente de Oro, they have small
para que las
cups
personas agarren su copita de
so
agua y
people
tomen
have
agua.
drinking water.
Y cuando estamos ahí con la
So
comunidad,
when
pues les
we're there
explicamos
with the community,
que ellos tienen que tomar agua,
we motivate
agua,
that we have to
todos
drink
los
water
días, todos los
every day.
días. Y pues estamos contentos con este programa
We
porque
are very happy with
todo
this
el mundo
project.
está colaborando.
Everyone
Ellos
is
nos
collaborating.
ayudan y esperamos seguir incitando a todas las personas, a toda la comunidad latina
We wish to
que
continue
continúe tomando
addressing this
agua.
issue, raising awareness about drinking water and replacing water with
Y-
water.
Y incluso todos los
Ah.
restaurantes, algunos.
Some of the restaurants
A un principio decían no, pero ahorita están sumamente positivos
Right now, they're very
con el
positive.
programa,
They feel very
están
positive
súper
about the
contentos,
program.
están colaborando
They feel
con
very happy.
nosotros
They're
y
collaborating,
ellos esperan que el programa continúe
and they
adelante.
hope that they continue with this project.
Eso es todo. Gracias por escuchar.
Gracias.
So we just talk about the experience in setting up water stations, and basically it requires many visits. It's like you are dating somebody. You have an appointment. Really, you have this date with a business owner, and the first reaction was, but I make a living of selling soda. And in any way, if you place a water station here, I'm not gonna sell my bottled water. How can we do this? And so it took many visits. But luckily, what facilitated is that we had this relationship with the first owner of water station, Rigo, who is a community leader, Rigo Flores, who is a community leader who is very conscious about our Latino community. And then we met with Rosibel, who is also a leader in our community. So once you have those people that engage and are aware about this, and that facilitated the process. And so now we want to talk a little bit about the barriers and the facilitators and with business owners, and maybe I can invite Rosibel to hear your perspective. Rosibel, as a business owner, you're a very successful business owner with and a leader in our Salvadorian community, and you have many businesses. What is your perspective? What are the barriers? If I come to you and tell you, I want to place a water station in one of your restaurants, grocery stores, or beauty salons, what will be your first reaction?
Let's get your microphone.
Good afternoon, everyone.
Good
My
afternoon.
name is Rosibel Arbaiz, and I own a beauty salon, and then I own a grocery store. And I'm not gonna, if you see me, I used to wear a size 14. Now my size 2. So that means I learned how to drink water and I learned how to eat healthy. Why? Because in this kind of age what I have right now, it's kind of difficult to keep it up in good health. So I learned about that. And I have a grocery store. But that's, I always gonna say water is the best juice you can buy. It's not only the cost of the bottle, it's the health that you drink it. So for me, it doesn't make any change. I'm gonna say drink water. Even I sell sodas, juices. It's up to the clients. But I think I have the opportunity to say, to teach everyone, because that way I'm gonna feel good. How come I'm gonna feel good and I'm gonna sell whatever I don't want to drink? And I don't think that's a good position. So for me, the best thing is drink water. If you don't like plain water, like I don't like plain water, you can add lemon, you can add apple, so you can have a little taste of the water. I understand a lot of our community, our people don't like plain water, but we can add anything we want and be healthy, because it's a lot of communities what they don't like to drink water. It's not because we don't drink water back home. What happens is we care about the health is. The water can be clean, the water can be good to drink. But in here you can buy the bottle and drink and put it whatever you want. Thank you.
Maybe Lucia, can you expand a little bit more? Puedes expandir un poco más de todas estas visitas y las barreras que enfrentaste, and you can share a little bit about the barriers that you confronted visiting the business owners.
Hola, buenas tardes. Pues mi nombre es Lucía Martínez. En realidad, yo empecé el trabajo visitando a los restaurantes.
I started visiting the restaurants. My name is Lucía Martínez.
Perdón.
No, that's okay.
Y en realidad encontramos muchas barreras.
We found so many barriers.
Ya lo decía Lidia, la gente pues tiene que vender sus sodas, sus jugos, sus horchatas y todo eso.
People want to sell their products, juice, horchata, sweet drinks.
Y no van a tener ahí un recipiente con agua y ofreciendo agua y dejar de vender.
So they're not going to have like a water station and offer people water and not sell their products.
Esa es una cuestión que encontramos de resistencia. La otra
So we
es
found that
de que el recipiente, los niños juegan con ellos y hacen mojazón, riegan el agua y se pueden caer. Entonces,
The other barrier that we found is that the water station might be accessible to children, for children to play, and that might place the water, water spills, and then of course high risk of falling, and that's what we heard from some of the business owners, that it's going to be a liability for them to place a water station because they can be sued.
Sí, hasta se nos hizo una propuesta que mejor pusiéramos botellitas de agua, pero como ese no es el fin de tomar agua, sino que es del chorro.
So we even had a proposal from one of the business owners, why don't you develop a product with like bottled waters, tiny bottled waters, and then we felt that we want to promote tap water.
Esa fue la propuesta que nos hizo el restaurante de La Chiquita, que es bien
That was
famosa
the
allá en el
proposal
Uriyoán.
that we got from La Chiquita restaurant.
Porque ella tiene botellitas de agua con el nombre del restaurante.
Because she sells bottled waters with the Chiquita name on it.
Entonces, y como ven, sí, la gente pues de los restaurantes no quisieron participar. Solamente tenemos 2 restaurantes, que es Pollo Rico y el Puente de Oro.
So most of the restaurants did not want to participate, but we were lucky enough to get to restaurants like Puente de Oro and Pollo Rico.
Pero sí visitamos toditos los restaurantes
We visited
del
most
área.
of Langley Park restaurants.
O sea que nos hicimos famosos con todos ellos y comiendo la comida
We
de
became
ahí.
famous and we tried all the food around Langley.
Porque teníamos que gastar algo para
Because we
poder
had to
entrar.
spend money in order to be there.
Así es que Si ha engordado, pues es eso.
So if I gain weight, it's because of that.
Bueno, pues no sé, esas son las barreras que encontramos. No sé si se me queda otra, pues también aquí las comentamos cuando nos reuníamos para comentar las barreras.
So those are the barriers that I can think of, and I don't remember any other that come to mind. Woody, you have some others.
Yep. So, Lucía, la última vez que habíamos discutido, nos habían contado como de anécdota, que había tal vez un problema con llenar las botellas, las fuentes de agua con agua de grifo.
Correcto.
Y que querían que fuera agua que
botella.
estuviera limpia o de botella, filtrada.
Filtrada.
Entonces, ¿nos puedes comentar un poco de eso? Y tal vez usted también, Rosibel, si quiere comentar sobre eso y por qué la necesidad de tomar o la falta de confianza.
So now we want to hear about the lack of trust in the business owner wanted the water stations to be refilled with filtered bottled water, not with tap water. And so we want to hear a little bit more about Rosibel's perspective and Michelle's perspective about that cultural barrier.
Bueno, es que en la comunidad también se da la cuestión de que no tienen confianza en el agua de la tubería, porque
What happens in our community is that there's a high lack of trust about tap water.
porque le encuentran mal sabor o
They
porque
find it-
sale con color amarillo.
That it has a yellowish color and it tastes bad.
Entonces, y como dicen los dueños de los lugares, para que no pueden poner agua que les vaya a enfermar a las personas, porque son clientes que llegan y tienen que darles seguridad, aunque les decimos.
Right, so they feel apprehensive about having tap water available to the clients because they might think they might get sick and they're going to get a suit or something about getting sick.
Que les decimos que el agua de embotellada pues viene también de un chorro, ¿va?
But we tell them that bottled water comes from tap water as well,
Entonces, pero no lo creen, entonces
but they don't believe it.
tienen miedo a eso porque les puede caer cualquier demanda y aquí
They're
está pues
afraid.
la dueña del salón de belleza que también doña María nos dijo que ella quería las botellas de agua.
Here she is, here we have the business owner, and her manager told us, I want bottled water in this water station, not tap water, because I'm just afraid I'm gonna get my clients sick.
Eso pues, esa es
That's
otra de
That's
las
another
barreras.
barrier that we encounter. Okay.
¿Usted quiere comentar sobre eso? Me interesaría saber su opinión.
Yeah, we would like to know Rosibel's perception about this cultural barrier.
Bueno, I'm gonna say in Spanish too.
That's fine.
El problema es que en mi posición,
The problem is in my position.
washing the hair with the water, regular water, that's what I think. Muchas personas creen que el agua tiene mucho cloro.
Many people believe that water
Del
has
agua.
too much chlorines from the water.
Entonces llevan a la mente que el agua que toman también viene con mucho cloro.
So the perception is that that water has chlorines on it.
Entonces por eso le
Chlorine,
tienen
excuse me.
chlorine, yes.
Yeah.
Tienen miedo de abrir y como muchos comerciales también. En mi caso, en la MAN Presa, where I work in MAN Presa on the street in Washington. Toda la semana llega una persona a probarme el agua del gobierno. Entonces creen que el agua no sirve de la fosa, que está contaminada.
¿Quién cree?
Los clientes.
So clients think because just someone from DC government tap office, water office comes and checks my water.
Every
they
week, a person comes from the government and check the water. So my clients don't like to drink water because they think the water is contaminated. So, por eso les quieren a la botella porque está contaminada, creen que está contaminada.
They truly believe that tap water is contaminated.
Por eso es que yo creo que creen que el agua de botella viene más limpia.
So they think
Entonces
water
tienen miedo
is clean.
tomarla.
They are
Entonces
afraid.
yo creo que tenemos que dar la voz, correr la voz, tell everyone and explain to everyone que todo es diferente, que el agua es safe, es segura tomarla de la fosa, del chorro. Yo creo que I think we have to let people know it's safe. Porque ellos creen que tiene mucho cloro y creemos que mucho cloro nos enferma.
So we associate that with tap water having chlorine, and that can make us sick.
Sí. Yo creo que en eso tenemos que trabajar.
Okay.
So we need to work on that.
I see you guys are waiting to, like, holding back on commenting. So if you either.
Actually, let me do the researchy nerdy thing, and then you come in with the practical thing. I'm Lisa Ragain. I work with the Council of Governments, and I work with all of the drinking water utilities in the region. So I get a full range of different customer reactions, people reactions, different water systems. I am also a recovering academic. So I used to work here at GW, and a lot of the work that I did is on perception around drinking water safety and other things that affect how much people consume water. And the chlorine is actually a pretty consistent marker across, across continents. So if people grew up with drinking chlorinated water, they associate that smell and that taste of chlorine with it being clean, especially if you're over the age of 50. And they're used to it. So it doesn't really affect whether or not they actually want that little bit of chlorine taste, because to them that signals that the water's safe. If you grew up not drinking chlorinated water, whether it be in any other country or this country for that matter, people are going to a lot of times have the perception that that chemical taste is not good, even though the whole reason it's there is to disinfect the water so that you won't get sick. So it's this constant balance, and it gets back to kind of the key things you want for a really good glass of tap water. If you look at the linguistics research and you look at all the other types of social science research, clear, cold, crisp. And that means that having the ice water and the cold water is absolutely essential. And a lot of people, especially in other areas of the world, have never had cold water. Like that's not something that they've necessarily had access to, so that makes a huge difference, is making sure that it's really crisp and really cold. And cold actually almost completely eliminates the chlorine taste for all but the most super tasters. So that's why those combos are so important. And it's something that a lot of water systems struggle with, is that I want the water to be really safe all the way to my customer, but the customer has a different association with that chlorine taste and smell than its intended use. And Luis is going to talk about the practical applications of this.
Hi, so my name is Luis Maya. I work for the water company, WSSC, that delivers water to Langley Park, as well as Montgomery and Prince George's County.
Yes.
So, I do want to say, so I'm from the water company, but we're more than just a water company. I do want to say that to the business owners, to all customers. We're there for you. We want to be a partner and want to help you educate your customers about tap water. I do want to say that we've been in business for almost 100 years, and I'm going to drop this one just because I have to. We've never had a single violation, federal violation of our drinking water. It's been safe for 100 years. We are strictly monitored by the EPA. So with their standards, we've never had a violation. So you can tell that to your customers. And as I mentioned, we want to help you educate them. We have materials in English and in Spanish. And if we don't have it in Spanish, we will make it in Spanish. We have new leadership, and our new leadership definitely wants to focus on the customers, both businesses and residents. I lost my thought. I was gonna respond to a question. That tap water. A lot of people talk about they want to drink bottled water, and yes, a big percentage. I think it's more than 25%. Is bottled water is tap water. So they are drinking the same thing. A lot of people pay for their water every month. Either it's included in their rent or they have their water bill. but they are paying for it. And what we always like to say is that, you know, tap water is the best value. And, you know, you can pay $1.25 or so for a bottle of water. When you pay that to WSSC, you can fill more than 1,000 bottles of water with that. And it's the same water that you're drinking. And I'll respond to any of the questions. There's a lot of things that I wanted to interject in here, and I'm sure they'll come back up. But yeah, I'll definitely want to go back and forth with you all.
Yes, we have a question.
And this is really for anyone, but I'm just so thinking about this mistrust of the water supply, and then thinking about what's happening in Flint, and then also thinking about, I hear the same thing in vaccination discussions. And how do you overcome that? Because that is really scary. If you are really thinking your water is not safe, and just having someone say it is safe, it's not going to help. So, like, what's the bigger messaging strategy?
Oh, that's such a good question. So I work both with all of the water utilities in the region and their service areas are up on this map, and I will own it is a very difficult map to read, but there's a lot of water utilities in the region. But that blue area on the right, that solid kind of baby blue area, is the WSSC, and they serve that entire part of Montgomery and Prince George's County, just to give Louis a plug. So there's these discussions. So there's two different types of mistrust. So there's it's not the same as what I was used to, I have had a different culture, I've had a different experience mistrust. And then there's kind of the media, and even if it's not as specific as it, it's just kind of like this constant erosion, and you see it if you look at polling data. 3 years ago, tap water trust and taste was the highest it's ever been in the Gallup polls. 3 years later, you see a significant drop. So it's a discussion that we have to have within the water community, and it also is part of what I've spent a lot of my time doing, is broadening it into the public health community as well, to have a lot of those back and forth discussions about what can we do to make the biggest difference in different populations. And it's obviously not one answer or one strategy, because kind of like vaccinations, it depends. The why is a huge driver.
But I would like to add that talking with our community, because we place water stations also at schools events, the issue is that they do not trust the water. But also we are inundated in the Latino community, in the Langley Park area, with people selling filters, very expensive filters. And they come to your home and conduct a test with the water, and for some reason the water comes out bad. And I was talking to one business owner, and she said, you know, Yvonne, and I mentioned, you know, the water company, please go to their website in English and Spanish, and they can tell you that, you know, the water is safe. They have done all kinds of tests. She goes, really? I didn't know. So people in our community are not aware. And we have all these people trying to sell very expensive filters. And she was really thankful to me. And she said, you know, I was just about to sign for this very expensive, like $500 water filter. And I'm very thankful. And I said, I left the papers, you know, the materials that we have, and contact the utility company.
Right, and it's funny you mentioned that, because we get calls every once in a while that if they know about a company that's going around door to door selling these filters. And they do say that they pour something in their water and then it turns brown. Not sure what that is. We have our own police department. We actually sent a police department to try to investigate that, but we don't know exactly what they're doing. They tell them that they have lead in their system. So they can call us and find out that, you know, ask those questions. We have a lab. They can get their water tested. We have a water quality report that every water utility has to put out every year. We have that. We can deliver that in English and in Spanish. We can explain the water quality report because it's not the easiest one to read. We're working on that. And but yeah, I mean, they can ask us any of these questions. And yeah, the definition we're going to have to deal with is how do we counteract the people that are going door to door telling them that the water's not safe when it really is.
Right.
And I'll throw in at a regional level, because we do coordinate around so my job is to coordinate all of these groups, but also our members are all of your elected and public officials, so the county councils and the mayors, but also your city administrators. And the more that we find, like, the more that we get that kind of feedback, the more we can coordinate a campaign, because every single time there is a major media item in the newspaper or on TV, these companies come out of the woodwork, and they're doing it, they're not just doing it in Langley Park, they're doing it all over the region. And they are very, very good at targeting people. So the more you can let people know, the better we can work on that issue.
So, yes.
I also wanted to add that these sellers, you know, they build trust. They're dressed in lab coats and they go door to door and they're speaking Spanish and they, you know, and they build a rapport. And research shows that one of the best ways, especially among Latinos and I think other vulnerable populations here in the U.S., where they get their information is through family and friends. And you know, if they get their information from the EPA, they're least likely to drink tap water, which is interesting. But I wanted to invite Lydia to also talk about how she managed to talk to some of the restaurants into having tap water in their water up stations.
Bueno, voy a reforzar un poco sobre lo que estamos hablando.
I would like to emphasize about what we were talking about.
En primer lugar, lo que tenemos que hacer es educar a la comunidad.
First of all, we need to educate our community.
Eso es lo que estamos haciendo, la educación, al mismo tiempo haciendo conciencia sobre el agua.
We are educating and raising awareness about drinking water, and that's the first thing we need to do.
Las personas tienen diferentes reacciones cuando uno le dice que tiene que tomar agua de chorro.
People have different reactions when we tell them, go ahead, it's okay to drink tap water.
Dicen que está contaminada, que tiene mucho cloro.
They tell us it's contaminated, it has chlorine.
Pero al mismo tiempo le explicamos que el agua de chorro tiene fluoruro.
But at the same time, we let them know that tap water has fluoride.
Tiene fluoruro, eso le ayuda a la protección de sus dientes
And that is
y sus
gonna help,
encías.
with your teeth, preventing caries.
Entonces, cuando uno empieza a explicarle a las personas, ellos piensan y dicen, ok, voy a empezar a tomar agua. Y de esa forma venimos trabajando.
So we have been working with that way, just talking to people, raising awareness about drinking water.
Que hasta este momento el restaurante Chicken Rico
At this time, Chicken Rico restaurant
se está poniendo el agua del chorro.
they are using tap water. Very good chicken, by the way. Peruvian.
Yeah.
Langley Park.
El segundo es el Mall de la Unión, ricos paletas, ricas paletas.
And Ricos Paletas at Union Mall.
Yeah. Están tomando ya agua del chorro.
They are also having tap water at the water station.
A un principio ellos decían, ¿por qué? El agua está contaminada. Y le digo, no está contaminada.
At the beginning, the reaction was no, the water is contaminated.
Este es un programa de la Universidad de George Washington.
And I will tell them, this is a program from the George Washington University.
La universidad, si usted no confía en el agua de chorro, viene y le hace un examen, un test. Y
Yeah.
ella le va a demostrar que el agua no está contaminada.
So we can request the university to come by and conduct a test with the water, and you can tell, we can show you that the water is safe to drink.
Y hasta este momento tenemos a estos dos restaurantes
So up to now we have these two restaurants really using tap water.
que ya empezaron a tomar agua de chorro.
And they're starting.
Estamos haciendo conciencia a toda la comunidad
So we're raising awareness in the Latino community, in our community.
para que empiece a tomar agua de chorro. Le explicamos que lo que hacen las compañías, llenarla del chorro hacia la botella.
That what the bottle companies do is really get the tap water into the bottled waters. So this is what they're getting.
Y lo más seguro es lo que la Universidad de George Washington promueve, y no lo que las compañías promueven,
So,
porque lo
in
único
any
que hacen
event,
es vender el agua.
What the university is promoting has more weight than what the companies are promoting.
Y de esa forma continuamos trabajando.
And we continue working, raising awareness. Puente de Oro, wonderful fry fish.
Yeah.
Golden scissors, my gosh, I get my hair done, blow dry for $20. Where in the world? Golden scissors, Langley Park, haircut. I mean, you know, we really support our business owners. The Pollo Rico has Peruvian, I mean, the prices just stop by.
A mí me sorprendió porque yo hablé con los dueños del restaurante Pollo Rico
No, it's okay.
y ellos decían,
Okay, I was wrong with the prices. Okay, what is the real price for getting haircut and blow dry?
It depends. It depends the length of the hair. It
Okay.
depends. We start at 45.
Okay, that's still a very good price.
Translator, we need you, bye, as a translator.
los dueños del Pollo Rico, ellos están promoviendo el agua. Yo hablé con ellos y yo les explicaba a ellos
I spoke to Pollo Rico owners. I talked to them
sobre el agua porque ellos venden sus refrescos y su soda e incluso la Coca-Cola está a la par de la estación del agua.
And guess what? The Coke and the sodas are right beside the water station.
Y ellos me dijeron de que, pues, que era muy importante porque después de la explicación que se les da, ellos toman conciencia.
So after talking with them many times, there is awareness and they're conscious about it.
Y ellos dijeron que pues ellos nos iban a ayudar a hacer conciencia en la comunidad latina.
And they told us what we're going to do is also make you out so that we can raise awareness in our Latino community.
Y siempre me ofrecen pollo asado cada vez que voy.
And every time I stop by, they offer me this wonderful grilled chicken.
Gracias.
Thank you so much. We have another question? Yes.
Hi, thank you first of all for doing this. This is really helpful. I work also at the School of Public Health here, and from a professional and personal level, I have a daughter in the DC public school system. So, but also from the professional level, interested in increasing water consumption, decreasing sugar drink consumption. And I'm curious about two things because it was mentioned. If you have an event, say, be it in Flint, Michigan, or for example, last school year in DC, we had lead found in some of the schools, and so there was water was tested in school locations. And so when you have an event like that, that then gets lifted up and people are afraid of water, and then put it in the school system, then people get really afraid. What do you do, and then what do you do to kind of communicate the truth about tap water? And then also, who are the trusted sources? You mentioned the government officials are not trusted sources of information, but
It depends.
okay, yes, that's
So, if you want to have an offline conversation about lead, I can give you the ins and outs, but some of it is, one of the challenges with lead, just in general, is that the lead is not in the water coming into the school or into your home necessarily. It's from your, if there's lead, which it is coming from something in that building, which makes it a much bigger challenge in some ways. So we, as a region, when I say, so I'm talking about the Royal Water, we are really trying to work with some of the school districts on how to work on messaging some of that, because the other thing to understand is that the water moves through the building all day, and so even if there is lead in a single water fountain, and a lot of times it is only a water fountain or a faucet, sometimes it's more, that once that water starts moving for the day, that lead's gone and it's cleared out, and that's a very challenging communication, to not sound defensive,
exactly.
but to give you accurate information is always a huge balance for us. And then the other thing we do, and so on the Happy Water, what COG does is we have the Tap at Metro DC, John, stand up, wave. John is Catholic. And this is kind of like a super extension of what they're doing in Langley Park, where the entire, it's an app you can download, and it'll give you the location of where you can get your water bottle filled all over the metro region. So it's everything from restaurants to libraries to parks and rec centers to stores all over the region. And so that's one of the ways we do it, is we get people out and about talking about how affordable it is and how they can check things out. And so this is one of our primary ways of making sure that people understand and start, a lot of it's developing a conversation about your drinking water too. People, it's not something people stop and think about. It's a habit for a lot of people, whether it's bottle or tap. And so part of it is developing that ongoing conversation and thinking about, wow, that water travels through a lot of pipes to get to my house. Huh, I wonder where that water comes from. Even those kinds of basic, there's a new study coming out that shows that people who understand what their source water is have a better understanding of what the contamination is or isn't there in their water coming out of their tap. So how many people here know where your drinking water comes from? Where do you think your tap water comes from if you live in Langley Park? Where do you think your tap water comes from if you live in DC? No, not the Anacostia on that whole clean front. Never the Anacostia. So over, right, so just in general, over 80% of this region gets our drinking water from the Potomac River. And so we all have the same source water, so we all work on source water together as part of it. And WSSC actually has not one, but two
right,
water sources.
We also have 1/3 of our source water is from the Patuxent River. So, and we have two plants. We have a smaller plant out of the Patuxent and then one out of the Potomac, who serves 70% of our customers.
And never the Anacostia. There is no water taken out of the Anacostia for drinking.
What about Virginia?
So Virginia, again, we have there's different places where the water goes into the system, but so in Virginia, you get it from the Potomac, and if you live in almost all of Fairfax County, Prince William County, and Loudoun County, your water is coming from Fairfax, either the Potomac at Fairfax or the Occoquan Reservoir. If you live in eastern Fairfax County, Falls Church, Vienna, or Arlington, your water is coming from the same place DC gets their water, at the Washington Aqueduct. And I forgot, I didn't mean to leave out Alexandria. Alexandria gets their water from Fairfax Water as well.
So, after hearing all these challenges and these barriers, and we do have another question. Yes, Nicole, go ahead.
Oh, yeah, my question is related to, you brought up the DC school systems and lead in their water, and I know from being on the project that we've also had challenges kind of going into the Langley Park school system and getting the water test results. Maybe on a national level, what are the barriers with collaborating with the education and school system on the water issue, and how do you think that those can be addressed?
So that is a long enough and in-depth question that anybody who would like to have a small focus group, we can talk over here, because it is a wonky, complicated answer, but I'm happy to have the conversation.
Absolutely. But now we have heard about challenges and barriers about our project in Langley Park. The issue, the message is drink more water. We are promoting water consumption because our interest is that people will drink more water and replace those sugary drinks, especially in our Latino community. We have all these juices, horchatas, tamarindos, name it, so many refrescos. If you go to a Latino store, you get agua de Jamaica, but they are wonderful, but they have lots of sugar. And then you have the sodas. So what can we do in order to promote, and next steps? Can anybody would like to contribute, please, about what to do next? What are the next steps?
And if I may add, especially we want to hear from Rosibel about where do you envision for water up stations? Do you see this working? Do you see that the consumers or the customers are coming to you, they're drinking more water? Do you see this as something that could be easily incorporated? Because if you go to other states and other businesses, this is a natural thing to do in any business, to just offer water to your customers as they come in, especially if you're selling food, or if you're waiting for your hair to get done. So do you think that that is something, do you envision that that is something that would be appealing to your customers?
Well, let me tell you something. All of this year, people believe in a person. Like people believe in me.
Yeah.
Like when they go to you, I used to sell tickets. They used to come to me and say, can I buy my ticket? I give you the money right now, and then I buy me my ticket later. A ticket, travel ticket. People, a lot of my community, I can say about my community, they believe in the person. So what you can do is go to the business or go to any activity, the community activity they have, and drink the water. You know, show them you drink regular water. Because if I say to my family, I drink regular water, they're going to drink regular water because they believe I drink something, I put it in my body, something, it can be trust. Okay? So that's what you have to do. You have huge company because if you teach to the community, I drink water from the tap of water. If I see Uriyoán with the bottle, I'm going to say, why did she drink bottle of water? And she tried to explain to me, drink tap water. I'm not going to believe that, so that's what I think we can do it. We have to drink tap water. So they're going to look at me like she drink tap water. So I believe that's a good water. That's what I do. That's what I do with my clients. When they come to the shop and say, my head is falling because I think there is a lot of chlorine, I say, no, it's not the water. It's the chemicals you put it or the conditioner you put it on your hair, or you don't put a conditioner on your hair, you know? So that's the way I think is the better way for me work. I believe in the other person. Like I believe in my own family. I think that's the best way to do it. I don't know, maybe I'm wrong.
So what we're hearing here is that there's a lack of trust.
Yes.
And people look up to people like Rosibel, who's a business leader, and people look up to women in their own families, in their communities, that they can look and they can trust and they can model from. Something else, Mercedes, I would love to hear from you because I know you work in Langley Park with our Latino community. You know, what can we do? What are the next steps? And we have to build trust. We heard from Rosibel. Build trust in your community.
Yes.
Because this is a community that has the lack of trust is so high. And I work with this community, conducting surveys, conducting focus group with public health projects, and I know lack of trust is one of our challenges.
Yes.
Yes. Mercedes, would love to hear from you. And you can introduce yourself.
Okay. My name is Mercedes Lemos, and I'm with Prince George's County Health Department. And everything everyone said, I am in total agreement. And I feel education is the most important part of this initiative. And I started attending your initiative in Langley Park, and it created a lot of awareness to me, to myself, about the water. So now whenever I go out, I'm always looking at the drinks and looking, I'm like, I think I'll go with the water. And so it's just creating awareness. And I feel in Langley Park there has been, because of you, your initiative, it has been a lot of awareness created, and I see all the posters.
You see that the people are reaching for it and serving themselves water and perhaps drinking more water.
En mi negocio yo tenía la máquina de sodas. La quité.
Yeah, in my business, I had a soda machine.
Yes.
I took it out.
No more sodas. buy, because if I drink water, I'm gonna give it to my client because I like my client. I'm gonna give it water. What I have is water. But the only thing I'm gonna change now, I'm gonna give you water from the tap water. No voy a comprar más agua.
I'm not gonna buy de botella.
De botella.
Wow, that's a statement. No, I'm not gonna purchase more
No,
bottled water.
voy a darles agua, voy a pelear, me van a reclamar, why?
I'm gonna
Why you
fight.
give me the water? Entonces, ¿qué voy a decir? Fui a un entrenamiento y me enseñaron a tomar agua del chorro.
I'm gonna say I went to a training and I was told and I was.
It's safe.
Yes, it's safe to
The
do
water
that.
from tap water is safe. Tengo que comenzar. I have to start to let them know they can drink tap water. It's safe. That's what we have to do. Teach everyone tap water is safe. So I think.
Yes, John. John is with tap water. Tap water DC. Metro DC.
Hi, I'm John. So I work for the Council of Governments, and my committee is made up of all of these water utilities and a couple other local and regional governments. I run this program and another program called Protect Your Pipes. I know, tap it, protect your pipes. Sounds like a safe sex campaign, but it's for And what really drew me to the program in Langley Park with Avance Water Up was it was all about community mobilization, and a lot of the time you can have someone in this too, from a water company, no offense, say to you, this product, our product is clean. They have a vested interest. They want you to keep using their water. They want to keep charging you their rates. But with the Water Up, seeing community leaders come and talk to their own communities about it, be able to put that language that's in these water quality reports, that's esoteric, it's confusing, it's, it's past most people's comprehension, being able to put that digestible terms, and also from people they trust, that's so important. And I go to a lot of events all around the region, and I table and I have, coolers full of tap water, I have materials, I tell them about the program, but also Tap It is really an educational campaign where I'm talking about because every single utility has a different water quality report, all of that. And it's those face-to-face engagements where I found the most drives behavior change. When you're able to tell someone, break it down, okay, well, what's this mean? Oh, what are you testing that for? Where is the lead coming from? And I think that next steps for, there aren't enough hours in the day, I'm helping to deconstruct WSSC's water quality report, because indeed, 98 years without a drinking water violation, which is huge, but no one really gets what that means. And when they look at this report, they see numbers that are in font 6, and you know what I mean? And they're just like, I don't. And so breaking that and taking all the information that's not unnecessary, but a little.
Make it easier to understand.
Exactly.
Required language that you can't change.
And I think that's important, is developing and distributing those materials to community members so that they can talk to other community members instead of,
John?
But I love WSSC.
Thank you so much, John. And Rosibeth would like to add something. And yes, an applause for the wonderful work. Tap It, Metro DC. Okay. Rosibeth would like to add
Download the app now.
More advice. More advice. Sí. Más consejos.
Miran esto. Cocos, salvadoreño, espera cereal. That means is my community has this group working for 10 years. We're going to have this October 8th is going to be our gala for 10 years. What we do with the money we raise that night, what we do is damos becas a los estudiantes en mi país y acá en los Estados Unidos. So it's like 28 scholarship from the students for 4 years. It's not only 1 year, 4 years. So I think it's the good opportunity. Yo creo que es la mejor oportunidad de ir a estas galas grandes de personas con credibilidad para que la gente crea en nosotros y decir, bueno, poner los tanques, como ponen en el business, los water station, and put one there. those big galas. Put a one there with the people giving information to everyone. So that way I think we're gonna
Make it happen.
make it happen.
Thank you, Rosa Maria. Thank you, Rosa Maria, for the job.
What we're hearing is that we really have to take every opportunity we have with in our Latino community. We have a few galas like this group, Cocos Salvadoreño Empresarial, that raises money for scholarships. Yes, and we have one more question.
I only have one thing, so I do communications, and my only suggestion would just be to replicate exactly what you're saying and lift up the community leaders, like faith leaders, business community leaders like yourself, and just literally have a person who represents that saying your simple message over and over and over, and then point people to that leader. I just identify a handful of the leaders in the different sectors and have them repeating the message,
That's very
which you're already
good.
doing. It just sounds like you need to
Excellent.
do more of it.
So, I wanted to add really quickly because I realized I didn't answer your question.
I think this is not working anymore, but anyway.
Is it working? Anyway.
Doesn't matter.
Doesn't matter. So what I was going to say is one of the things, if you look at the models that you've created here as far as working with community influencers and all of that, it's the same model you use for community organizing. It's the same effective model they use with beauty shops and barber shops for HIV/AIDS education. The models are out there, and it's up to the public health community to really drive a lot of this, because I love my water people. I love my engineers and my analytical chemists. They stink at this kind of communication. They're used to it's regulatory and it's driven and it's all of that. And so a huge part of getting everything, pulling tap water out. And you asked about who's the most influential.
Who's trusted?
Trusted. It's so the trusted, and where do you get most of your information? Not always the same question, as you know. So word of mouth is by far and away the biggest influencer and the most common, so the friends and family model. Trusted depends on who you ask and where. So in some places, it's a healthcare provider. In some places, it is actually the water utility is the #1 source of information. And in other places, it's a regulatory, like your state Department of Environment, those types of things. And it's incredibly variable. That the word of mouth and the community model is both the biggest influencer and the most common source of information.
And finally, and the message is difficult too, right? Because it's very subtle. We're not telling them, trust your tap water blindly. We want them to drink more water. And we want them to do their due diligence. If they have, they're concerned about the water, contact WSSC, or, we can serve as a resource as well, or flush
Sometimes
the water.
Stepwise too, like get them to bottled water as a choice. And then you can talk out what's their use of bottled water. You can have the conversation about tap water. You got to meet people where they are, John. I know it hurts.
Yeah.
If they want to drink a bottled water, turn it around and find out where it's coming from, and you'll see that it's come from a municipality. You're telling them it came from a tap water somewhere. Might not be this one, but it came from another one.
And if you didn't know that, if the bottled water says municipally sourced, that means it's just tap water.
Or
the statistics closer to 55% of bottled water is just repackaged tap water.
Yeah. So we're hearing again and again more information, more education to raise awareness about drinking water. Uri, would you like to?
We're out of time, so I just wanted to close. Thank you so much to the panelists. Really lively discussion, and I think it's time now to take it back to the other session. So thank you all for your interest and for coming.